Say that with love.
In a world where 1 in every 4 Black households fights food insecurity, we are fighting for food sovereignty so Black children can skip from grocery store to fresh marketplace, their plate affordable, their taste expansive and culturally crafted.
Welcome to Say That With Love, a podcast where we reimagine Black childhood with legacy, liberation, and love. I'm your host, Dr. Leah Austin, the president and CEO of the National Black Child Development Institute, also known as the president of the Black Children. So let it be known, in this space, we love Black children unapologetically and out loud. Today, we are focusing on food justice, nutrition, and child wellness. What it means for Black children to have healthy meals, how culture and community shape our food traditions, and why policy and advocacy must center dignity and love. At NBCDI, we dream of a world where every Black child enjoys meals with vegetables. Now, as a mom, I know enjoys might be a stretch, but I also know that every child deserves access to healthy food. And the truth is, many do not have it. In fact, 1 in 4 Black children live in a food insecure household. I saw this as a reality as a kindergarten teacher in Ward 8 in Washington, D.C., when a student came to my classroom with only a candy bar and a soda for breakfast. And I will admit that at that time, I probably judged without even understanding his circumstances. You see, I didn't realize that food access depends on where you live, and that too often Black children simply do not have the same options as other children. Today, I'm joined by Parker Gilkesson Davis, a senior policy analyst at the Center for Law and Social Policy, a writer, and a mother of a 1-year-old daughter and 2 bonus children. Her work bridges culture, policy, and community, reminding us that food is love. Together, we will explore how food justice and food sovereignty can shape a future where every Black child has access to nourishment, dignity, and love. Parker, welcome to Say That With Love.
Hello, thank you for having me.
Can you share with us what brought you into this work? Not just as a policy expert, but as someone who really wants policy to reflect lived experiences and community expertise.
Absolutely. So I started my career out as a social services worker in the state of North Carolina. So started out administering benefits like SNAP, TANF, Medicaid, all 3 programs. It was a lot, but definitely got to hone in my skills on realizing that we are in a system that does not fully serve people and that does not fully serve children either.
I'm sure given the experience that you've just shared, you have stories, right? So can you share any stories or experiences from your life, from your work, or even from your community that show the impact of food insecurity on children and families?
Absolutely. I have plenty of stories, but one that I'll share more recent. I'm from a small town called Peoria, Illinois. And over the last 10 years, we've lost almost every single grocery store on our south end of town, which is predominantly Black. So folks have had to travel far distances to get to food. People who may not have a car have to take multiple buses to be able to get to a grocery store or any fresh food. And so that's affected the community greatly over time. And just a couple weeks ago, we lost the very last grocery store that was even in closer proximity, unfortunately. So that has greatly affected the community in terms of children being able to have access to different foods. There are plenty of corner stores, obviously, but those stores are not necessarily nutritious with everything that is needed. So one thing that I will say that's a positive is that we have a program now going around only once a month to different community centers but they bring fresh fruit and vegetables into the community centers for different daycares or community centers where children are, which is awesome. The fresh fruits and vegetables are about $1. So you can get 3 peaches for $1. You know, most people are complaining now about the cost of fruits and vegetables and eating healthier, but they're doing it at such a discounted price and folks are able to access it. So now my goal is to try to help them to accept SNAP benefits. So that's the next thing that we're working on. But it is truly causing us to come together as a community to figure out what we're going to do to support children and support their families. But we'll point that out.
Absolutely. And I definitely want to come back to SNAP benefits and just the overall system. What I want to ask you about is helping our audience understand some connection points, right? So many times people don't really see the connection between nutrition, agriculture, and equity. So how might you explain that relationship to just like, you know, a person like me, a lay person who doesn't really totally understand how those 3 areas interact with each other?
Absolutely. So nutrition, agriculture, and equity. Yes, for sure. I recently did a piece. Will tie back into children, but recently did a piece just tying together overall Juneteenth, going all the way back in our history and tying into our current food system, different inequities that have taken place over time with just immigrant policies and the threats of ICE right now and how that shows up on our tables, right? So when we have different issues happening with our food system where people who are historically in charge of our food system, which has been people of color, whether immigrants or Black folks, right? When we are putting them through harsh conditions and inequitable conditions, that shows up in food pricing. Obviously, we saw the rise in eggs. We saw the rise in multiple different types of foods, just the cost. And so that shows up on so many different levels. And then going into nutrition for our children, I was going to go a direction. I'm not going to go there. I'll keep that for another day.
You're welcome to go there.
I'm in the Midwest, so corn is a big deal, and talking about the big 4: rice, corn, wheat, and soy. So a lot of even our food pyramid was eventually based on that industrial complex, right? So it's not necessarily what is most nutritional, but it is what makes the most money for this. Yes, I don't want to go there. That's what I said. I'll leave that for another day.
So let me ask you this, Parker. When we think about food justice and nutrition, we're often thinking about the choices that families are making. And I believe we're sometimes, if not a lot of times, thinking about those choices from a very individual, kind of personal responsibility aspect. And so I wondered if you might talk a little bit about what are some of the mental models or the mindsets that people hold that might make it harder for us to really understand just how complex of an issue this is.
Absolutely. Yeah. I hear all the time that, if they just have more education to understand how to eat healthier. Every community event I go to, they're trying to have some person that teaches either education on food and cooking or teaches financial education. And I always like to say people experiencing poverty specifically are the best budgeters out there, right? They're trying to put 2 and 2 together to make 4, and it's not always making 4. And so they're having to make choices, yes, and very difficult decisions that what's going to make my child feel more full versus what is going to be healthier at times. And if we were in a space where healthy food was the most affordable, it lasted as long depending on what type of job you are or what type of housing you have. We do have a lot of families who are experiencing homelessness. And when you are unhoused, that looks a lot different for the types of food that you could prepare as well. So I always like to share that with folks that it is a very complex issue. It is not just simply rooted in folks are not able to make the best decisions for themselves, And I also like to talk about, my colleagues and I have had multiple conversations with the USDA about redefining what is healthy food, not just around Eurocentric foods. Because, brown rice is great, but also, fufu, right? That's another carb that is in the West African community that is amazing as well, right? And they have about the same nutritional value. So we have to incorporate other cultural foods so we can understand that kale is not necessarily more nutritious than collard greens. You can make collard greens and it still be nutritional, right? There's nothing wrong. I think we've stigmatized our own food to feel that different things that we culturally make are not healthy. Obviously, there are healthier ways that we can make them, but not necessarily making it to where Eurocentric foods, chicken breasts or different items are the only standard of health. So that's another thing.
Absolutely. Oh, absolutely. And I want to come back to the role that culture plays in nutrition and wellness. My family, we actually came back from Ghana in June. No, we were there in July. And so when you said fufu, I had a whole flashback.
Oh, yes.
I had a whole flashback. And then we're also of West Indian descent. So think all about rice and peas and all of these amazing dishes that can be just as healthy as anything else that we're sort of sold are the healthier options. So wanted to put that in here, but we'll come back to talking a bit more and going a little bit deeper in the role that culture really does play and can play in our healthy foods and our access to healthy foods. I want to pick up on something you said, which is really around narratives and sort of the narratives that are told to us about the foods that we have access to and the levels of healthiness of those foods. And so the question I want to ask you is kind of a general question around why is narrative change so important to food justice? One of the examples I think about that I'll just lay out there is that there's been in the food justice movement a really important shift from the language of food deserts to the language of food apartheid. And I just wondered if you might talk a little bit about why that's so important to the food justice movement.
Absolutely. Switching from food desert to food apartheid makes it so important to understand that this has been systematic, right? It has been systemic. It has been something that happened through the process of redlining, we can go all the way down to the environmental effects of, not having trees in different neighborhoods. So many different things are completely and totally intentional. And so not just making it as if a desert is a natural occurring space, right? Food deserts are not naturally occurring. They are spaces that were intentionally formulated in that way. I don't know if you're familiar with PG County. I know you said you worked in Ward 8, so I'm sure you have. PG County is the nation's richest Black county, obviously, but it still has food desert areas, right? Which we would call food desert areas or food areas that suffer from food apartheid, right? So it doesn't even have to do oftentimes with socioeconomic status, but race does play a major role in that. So really addressing that, making sure that we talk about it, helps us to go all the way to how can we address getting children in those areas healthier foods.
Absolutely. So going back to culture and tradition, and it's probably wrapped up in this conversation of narrative change and how narratives shape how we understand the healthiness of the foods that we eat, but also how we understand the true access that folks have to healthy foods. So I just wondered if you might, say a little bit more. I mean, you brought up fufu, so say a little bit more about how culture and tradition shape the way we think about food justice for Black children.
Yes. First, I do want to talk about narrative change because narrative change is super important. It changes public opinion, and public opinion is what changes policy. I've written multiple white papers. I've done the research. That is a great tool, yes. But currently where we are, public opinion is what helps to change policies and what helps to change folks' minds. And so we have to recognize that public opinion and false narratives have created a lot of policies. and a lot of harmful ones as well. So we have to do the work on the back end to really change how people think about policy and how people think about food, how people think about poverty and all of those things, and demystifying them in between, right? So to your question about culture, and doubling down after talking about narrative change, culture, I mean, really edifying our culture and uplifting. And it's not this thing of like, I know I look forward to, I grew up in Illinois. We loved going to the corner store and getting maybe a nice little snack. What we called it, we would put ground beef and different things in the bag. Now, obviously, my mama was not letting me eat like that every day. No, but it's something to look forward to, right? There are different things of our culture that we should not be afraid of. Like I said, collard greens or yams or, so many different things that we eat that are amazing, that are becoming staples of America, right? I don't know if you saw the documentary on Netflix where one of George Washington's slaves created macaroni and cheese, right? We are the backbone, and our culture is the backbone of America. And making sure that we are not insinuating that some of our practices and what we love to eat are just unhealthy, right? And also, let's talk about health factors, right? Food is a big part of that, but also stress and what we have experienced stressfully racially also is a part of that. We can talk about that in terms of maternal health outcomes, right? Across the board, socioeconomic status, we experience more mortality rates, right? Why is that? Stress is incorporated in that as well. So making sure that we look at all factors to understand why different numbers are what they are, that is so important to me. And then, it's food is food. And let's not talk about negative foods or good foods. I try to steer away from that with my kids. There are things you can have a lot of, and there are things that you should maybe, have when this is treats, right? Something special. But really being able to destigmatize the fear around food and making sure that that is incorporated in access. Because there are folks who want to take away access to SNAP and to other and put sugary beverage taxes on things because they feel like that would help people eat more healthy. And that's not true. So being able to demystify and destigmatize things is really important so that we're not having negative policies that really do more harm than good.
Absolutely. And I know you do a lot of work around public policy and advocacy. And I know you have an expertise on SNAP. And so wondered if you might talk a little bit more about how in your own work, you are aligning or maybe, since we're talking about food, kind of mixing up, cooking up narrative, culture, policy, and advocacy directly in your work as a senior policy analyst.
Yes, absolutely. Right now, I think one of the major issues to talk about is this current administration wants to increase work requirements, and it does definitely affect parents. Usually, before, if you had children in the household, you were not subjected to work requirements, but this current administration wants to make it to where if you have a child that's over 7, you are subjected to work requirements. And we know that work requirements do not encourage work. They only encourage folks to enter into low-wage work that's volatile, that doesn't get their needs met, and that continues to push them into a cycle of poverty, unfortunately. So when folks are able to get their education and take time to caretake and do different things, we know that they're able to eventually transition themselves into a better life. So work requirements is a big deal that we're dealing with right now in terms of policy, just trying to do a lot of pushback and narrative change around just the overall idea that people experiencing poverty do not work. That's not true at all. That people experiencing poverty do not want to work, or that there are many ways that people actually are working. And caretaking is a job as well, especially if you have children. Okay. So we really want to push back on the narrative of the deservingness of who is supposed to receive public benefits. So that's one thing that I would mention in terms of policy right now and connecting all that together.
Listening to Parker, I'm reminded that food is never just food. It is culture, care, and community. When Black children face food insecurity, it is not because their families do not care, but because systems have chosen not to provide access. But communities are building new patterns. From free breakfast programs to community gardens, we see Black practitioners and Black families reclaiming autonomy and practicing food sovereignty. This is world building, rooted in love, reminding us that every meal should nourish not only the body, but also the spirit and imagination of our children. Can you demystify for our audience, perhaps, what foods are allowed or allowable when you're using SNAP benefits? Because my understanding is that there's some foods that are allowable and then there are some that are not. And if you could just maybe break down for us as much as possible so that we understand what's allowed and what's not allowed when you're using SNAP benefits.
Yes, absolutely. This is a great question. So currently, all foods are allowed. You can purchase if you're at a grocery store and they're not a hot food. So the only foods that you're not allowed to purchase on SNAP benefits federally are hot foods, unless your state did a waiver because there was a disaster or something that happened, or you are a participant in a restaurant program where if you're experiencing homelessness, which only certain states allow that. But for now, you can purchase anything that's in a grocery store that is not a hot food on SNAP benefits, which is really, really great because there aren't as many restrictions on it. However, there are folks in Congress who desire to put restrictions on it. And also there are different states who have put restrictions in their own state, not on SNAP, but for example, a sugary beverage tax or different things of that nature to discourage people from purchasing sugary.
Gotcha. Thank you. That's helpful to understand and kind of have that baseline. So I want to talk a little bit about healthy foods and actually how they're more than just about kind of fueling physical growth, but this more so overall nutrition, right? So like, how do you see nutrition shaping children's minds, their bodies, and a part of them that we don't often talk about, but their souls, like they're human beings, so they also have souls. So how do you see nutrition shaping their minds, their bodies, and their souls?
Yeah, I'm sure you understand because you were a teacher, but if you have ever been somewhere and you haven't eaten and you start getting that jittery feeling and your mouth is dry, you can't concentrate on anything, especially during that developmental phase of childhood, it affects everything down to their bones, if that makes sense. So being able to have nutrition and making sure that children are able to eat is imperative down to their soul. You know, when you were able to go to your grandma's house or your mom made your favorite meal, or even, you got a birthday cake. So many of my old clients used to love using their SNAP benefits to purchase a birthday cake for their baby. It really it's a way that we connect. It's a way that we love. It's a way that we communicate, if that makes sense, right? I made a dinner last night for my aunt. She turned 80. That was our love connection. She texted me this morning. She was so happy. You made macaroni and you made green beans and yams. That's my favorite. Yes, girl. Yeah. That's absolutely love, right? And imagine when kids aren't able to participate in that. I mean, really think about that. Just basic expression of love and basic expression of connection to one another, and that they're not able to experience that because, groceries are expensive and their parents may be having a hard time, which many of us have gone through that, right? Having a hard time, but that doesn't mean that you shouldn't be able to have a basic need like food.
Absolutely. I mean, yes, groceries are very expensive. Very expensive right now. And I love what you said. I mean, we're talking about healthy foods. And we want to talk about it in a way that it is not restrictive. I mean, I truly believe that food is love, it's language, it's memories, it's storytelling, right? And so while something may not be the healthiest item in the world, we still want to be able to experience it. And we want to be able to really leverage food for all of the wonderful and amazing things it brings to our lives. I also love that you noted education and educators and the role that educators can play. And yes, I was a kindergarten, first grade, and third grade teacher, so love the early childhood years. I wonder if you could talk a little bit more about why educators who already have so many things on their plates, right? But why educators, pediatricians, and advocates should care about children's access to healthy foods, and what role might they be able to play in ensuring that children do have access to healthy foods?
Yeah. So, like I said, just that example of, a child not being able to concentrate. We know that research shows that if you are not having a well balanced nutrition, if you are experiencing food insecurity, it will affect your education. It's not that it might, it will, right? Especially over time, and can end up resulting in developmental delays if that child is not able to get the nutrition that they need over time. And so if you are a teacher, if you are an advocate, if you are a pediatrician and you know this, I always love that this is our word for the podcast, demystifying policy. We just took advocates on the Hill a couple weeks ago, folks that we have in our community partnership group who have experienced poverty, have experienced receiving public benefits, and they went and talked to different representatives from their state. It really is that simple. You can call your representative, you can talk to on a state, local level, really share your expertise. You don't have to be just a policy wonk like myself, right? I took my previous experience and I'm using that now. And in your role or whatever role that you're in, you can use that to let Congress, to let your state representatives or even your mayor know how important this is, that if it's on the line for school meals to be removed, we can't have that. Some children, that is the only meal that they will receive, right? All day. And them having that critical focal point and them even being able to get breakfast in some states is what is going to be the bridge between them being able to achieve and not. And we can't have that in one of the richest countries where we're not allowing children to have access to food. So if you're passionate about it like me, I know you're passionate about it because you were a teacher and you love those babies, right? Use that passion to get into policy. Go to town halls when your congressperson is having them in your communities and to really share your expertise. Because when we get in the room and we're talking about our own lived experiences, they have to listen. It's not just data points, which I love. I love research. But it really is important to put faces to the statistics that we're talking about for them to really understand that, hey, I serve this population. I know what they're going through, and you will make sure that you do not vote on such and such policy that is going to affect children. Yes, super important. I'm very passionate about that.
Absolutely. The passion is coming through. And so I so appreciate that. And I love what you said about, yes, data is important and we need data points, but we also need to understand that the stories behind the data, that people and their real lived experiences make up the data. Those are, in fact, data points themselves. And so I even think about, the data point that is used often in education is grade level reading. And if children are reading at or above grade level in third grade. And I'm always frustrated and thrown off, if you will, by the narrow explanation of if children are reading at or above grade level or not. For example, we never hear anyone really explore how does nutrition and their access to healthy foods actually impact this data point. We're very narrowly focused on, okay, they can't read at grade level, so something must be wrong with that child. And we're not always understanding or really paying attention to all the inputs that are perhaps influencing that situation that beautiful, brilliant child is in. So I want to ask you this because I am future-oriented, love thinking, talking about the future and Afrofuturism. And so I wondered if you would kind of do some world building with us for a little bit and talk about if you could design a future where every Black child enjoys meals with vegetables, what would that look like?
That's great. Every Black child. I would say, just because we have a paper that we've written on like just overall anti-racist, what would that look like for an anti-racist SNAP program? Overall, I would love universal access to food. So universal access to a program like SNAP. If SNAP was not able to shape itself in that way, then creating a new program that would make sure that all children have access to food. And also universal healthcare, because you can't have access to food and then not access to healthcare. So those two things I think will be a major shift in the futures of our little ones. And I will also say more focus. I feel like when I was coming up, I have older grandparents and family coming from the deep South. So really more focus on community gardening as well. That was such a huge thing of learning that skill of how to garden, how to cook, how to do different things. I know they took out a lot of, wood shop and different things, home ec, right? Different skills that would have been useful. So really fostering that for different children to be able to have that love for gardening and have that love for having a green thumb and having just a shared community space, if that makes sense. I think community is a really big piece to the future. And I love that you shared Afrofuturist. So don't even get me started. Love it. Yes.
Absolutely. It sounds like we'll need to have a part 2 where we just dive into Afrofuturism. And I will say this, I love what you just shared. And I feel like one of the successes of the food justice movement has been an increased understanding in food sovereignty. So I think that we're kind of going back maybe perhaps, or it seems like I'm hearing at least a lot of people talk more about gardening. And I'm in Atlanta, Georgia, and know people who have little gardens of all sorts of sizes in their yards, and they're planting their vegetables. And I think that is something that seems to me that's at least coming out of the food justice movement, and really helping people to understand that we're always working within a system. And so what I think is the beauty of Afrofuturism is being able to look at the system as a whole and say, how do we redesign and reimagine this system? And at the same time, think about our individual ways that we can be impacting the system. And when I think about a community garden, that's one of these like beautiful examples of both trying to influence the system and kind of working at your neighborhood or your community level.
Yes, I love that. Absolutely. Community shared agriculture. It exists in a structured sense, but doing it more within our communities. Love that.
Absolutely. I love that. Well, Parker, I want to thank you so much for going on this food journey with me. This has been a really informative and wonderful conversation. Before I let you go, I wanted to just see if you had one piece of advice that you might give to our audience as they may be thinking about where they best can play in this food justice movement space.
Yes, that's a great question. So one thing that I would say, just falling into uplifting Black children and following your childlike wonder, I think it really is important. That's the best thing that I've been doing recently, is following your next greatest excitement. So really thinking about what makes you excited about food justice, what makes you excited about the futures of Black children, and wonder and imagine there and allow that to guide you on your journey and what you feel like you would bring. Because I feel like I've given the advice of, how to show up in policy, but I feel like we are just on the precipice. Oh, when you talk about Afrofuturism, you get me excited. We're on the precipice of birthing so many great ideas and so many great structures, and just coming together as a community in a wonderful way. And so each person has their own individual, beautiful thing to bring to that. So follow your own childlike wonder, and what is your next greatest excitement when you think about it. And I feel like if we all did that, we would be in such a much better place.
I love your childlike wonder. You can wander with wonder. I love
Yeah.
that. And I would say just continue that from being, the mother of a 1-year-old throughout their entire trajectory. I have an 11-year-old and I still feel myself actively tapping into his childlike wonder. So
Yeah.
I love that as closing advice. So I just want to remind us all, as we thank Parker for bringing her expertise and her experience, that food is love, and ensuring that every Black child has access to healthy meals is a matter of justice, dignity, and liberation. So here's the invitation. Invest in community gardens and create opportunities for Black communities to steward land, reclaim autonomy, and practice food sovereignty. Advocate for policies like SNAP that expand access to food in ways that are humane, rooted in dignity and love, and informed by the expertise of Black practitioners and Black culture. As an everyday person, look around your community. Do you have a grocery store? Does it sell fresh fruits and vegetables? If not, ask why not, and ask how do we get fresh produce in our community? As an educator or a parent, look at the school menu and see what's being served. Ask for vegetables if you don't see any. Lastly, let's be intentional with our language. As Karen Washington, often regarded as the mother of food justice, reminds us, food apartheid is not natural or accidental. It's the result of choices and systems that must be changed through collective action and imagination. Every action matters. Together, we can build futures where Black children are nourished in body, mind, and spirit, and where joy and well-being are at the center of our communities. Thank you to our guest, Parker Gilkesson Davis, for her leadership and voice. Say That with Love is a podcast from the National Black Child Development Institute. This episode was created with our ABF creative production team and our partners, and with love for the communities that inspire this work. And to Black children everywhere, we love you unapologetically and out loud. I'm Dr. Leah Austin. Thank you for listening.